So estrogen levels play a key role in maintaining healthy skin. So as the estrogen levels decline, so too does the integrity of the skin, which has one of the highest concentrations of estrogen receptors in the body. Welcome to episode 6 of In Clinic. I'm your host Danelle, registered pharmacist and lead practitioner at Clinic 1 Medical Aesthetics.
And I'm Alex, co-host and marketing specialist at Clinic 1.
On today's episode, we're going to be discussing how menopause affects the skin and some of the things that we can do to support its functioning. Now, the hormonal changes that occur during menopause can often happen very, very quickly, and they can affect the skin in various ways, such as impairing its barrier function, a loss of collagen and elastin, impaired healing ability, and dryness.
So what role does menopause play in affecting the hormone levels?
Well, by definition, menopause occurs exactly 12 months after a woman has stopped ovulating. But perimenopause, or being perimenopausal, is a term that's used quite a lot lately, and it simply means just being around menopause. During the perimenopause, the follicles in the ovaries that are usually stimulated to produce estrogen become less and less prevalent over time. So this is what leads to the eventual decline in the amount of estrogen that the body produces until a woman passes out of this phase and becomes postmenopausal when they're pretty much producing no estrogen at all.
So what is it about the menopause that causes the skin to go through such drastic changes?
So estrogen levels play a key role in maintaining healthy skin. So as the estrogen levels decline, so too does the integrity of the skin, which has one of the highest concentrations of estrogen receptors in the body. So within the skin, estrogen is responsible for the production of hyaluronic acid and the retention of water. So it plays a key role in the skin's ability to stay hydrated, its barrier function, and the ability for it to be effective in the wound healing process.
And what about collagen and elastin levels in the skin during this period?
So it's been well established that a loss of collagen and elastin in the skin is linked to postmenopausal age as opposed to chronological age. So studies have found that within the first 5 years of menopause, women go through about a 30% reduction in the amount of collagen and elastin in their skin, which then levels out to about a 2% loss year on year, which is double the amount of anybody else. So that'd be men or premenopausal women. This in turn leads to thinning and sagging of the skin and the appearance of fine lines and wrinkles.
So what kind of things can anyone who's experiencing a drop in their estrogen levels do to slow these changes down in their skin?
Well, there is, of course, hormone replacement therapy, which is more commonly known as HRT, which is something that I'd advise anybody who's interested in learning more about to speak with their doctor so that they have all the information to make an informed decision, because the use of HRT does come with some risks, but it has been proven to be very effective in maintaining skin structure and integrity. So there are also these really interesting compounds known as isoflavones, which are basically a type of plant estrogen that have been proven to have very weak estrogenic effects in animal cells. So again, they could be really good at maintaining skin structure and integrity, but this is something that I'd again advocate somebody to do their own research on first before taking any kind of supplementation. There are also things like collagen supplements, which have been proven, if taken regularly over a long period of time, can have some really, really positive effects on the amount of collagen and the thickness of the skin. So that's always another good option for somebody to look at. And something as simple as sunscreen, which will help protect the skin against oxidative stress caused by UV radiation, can again help to maintain that structure and integrity of the skin.
There's a lot that someone can do then to slow down skin aging. Is there any sort of aesthetic treatment someone could undergo?
So there are a few key treatments that somebody could undergo to help improve the integrity of their skin due to estrogen-dependent changes. Now, the gold standard for regenerative skin injectable treatments, that being polynucleotides, would be a really great option. The reason being is the way that polynucleotides work is they stimulate the cells in the skin that are solely responsible for the production of collagen and elastin. So what better way to improve the levels than target those cells directly? I've actually got a full episode on polynucleotides and how they work on my YouTube channel, so that'll always be good for people to go and check out if they're interested in that treatment. Alongside polynucleotide treatment, we have things like skin boosters. Now, these work in a very similar way to polynucleotides, but they're slightly different. These would probably be a better option for somebody who's experiencing symptoms of dryness in the skin as opposed to maybe a loss of collagen and elastin. Finally, treatment with dermal fillers is a great option to help provide support to tissues and a little bit of rehydration, which can work together to help improve the laxity of the skin and things like anti-wrinkle injections can help improve the appearance of fine lines and wrinkles.
So it sounds like it's best to take a tailored approach in supporting menopausal skin then.
Yeah, so I think that any aesthetic treatments that are aimed at improving skin structure and integrity, a multifaceted and tailored approach is always the best angle of attack, and it often gives results that the patients can be quite happy with. It's important to remember that the skin is the largest organ in the body and it has multiple functions and multiple layers, so getting it to work more efficiently can sometimes require a little bit of patience and a little bit of more of a long-term approach to make sure that we get things right. But nonetheless, good results are definitely achievable with the right kind of treatment tailored to each individual's specific needs. If you'd like to book a consultation with us or find out more about the different treatments that we offer that can help improve the appearance of your skin, hit the link in our description that'll take you directly to our link tree where you can contact us via WhatsApp or download our treatment guide directly to your device.
Don't forget to like and subscribe if you enjoyed today's show. Hit the bell if you're watching on YouTube to get notified when our next episode is out. And if you have anything interesting to say, leave a comment. Thank you for watching.